Hello and good afternoon. Thank you for joining us for our September Choices Community of Practice Coffee Chat. The topic for today's event is investing in a healthier future, how a sugary drink excise tax could improve health and health equity in Massachusetts. My name is Molly Garrone, and I am a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. School of Public Health. And as always, I'm happy to be the facilitator for today. I would just like to acknowledge our funders who make this work possible and share that our Choices work and events are only for research and educational purposes. The intention of today's coffee chat is to provide information, tools, and resources to inform and educate, and we are not looking to influence any specific legislation. I also want to note that our guest speakers today have been invited to share personal perspectives and do not speak on behalf of Harvard. If you are unfamiliar with the Choices Community of Practice, we are a network that includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. Our coffee chats are unique opportunities to share ideas and enhance connections in an informal setting. Today, we will start by hearing a presentation from our speakers, and then we'll be opening up the floor for a full group discussion. Please do feel free to share any questions or comments in the chat at any time today. So for today's coffee chat, we will be discussing the progressive health and health equity impacts of a sugary drink excise tax, highlighting some recent findings from modeling a statewide tax in Massachusetts. We are excited first to be joined by Sara Bleich. Dr. Sara Bleich is the inaugural Vice Provost for Special Projects at Harvard University. She is also a professor of public health policy at the Harvard T.H. School of Public Health. With more than 180 peer-reviewed publications, she is a policy expert and researcher who specializes in diet-related diseases, food insecurity, and racial inequality. Prior to this, Dr. Bleich served in the Biden administration as the Director of Nutrition Security and Health Equity at the U.S. Department of Agriculture. Dr. Bleich was elected to the National Academy of Medicine in 2023 and holds a BA in psychology from Columbia University and a PhD in health policy from Harvard University. We are also excited to be joined by a member of our own team, Steve Gortmaker. Dr. Stephen Gortmaker is a professor of the Practice of Health Sociology and Director of the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. School of Public Health, and he currently directs the Childhood Obesity Intervention Cost-Effective Study, or Choices Project. So welcome, Sara and Steve. We are really excited to have you both here as our guest speakers today. Without further ado, I'm going to begin the presentation with several questions, actually. I'm going to kind of queue up for you, Steve, to start us off and sort of orient us a bit. So we'd love to hear a little bit more about sort of, first of all, why sugary drinks are so harmful to health. And can you describe the results of the recent Choices report modeling a sugary drink excise tax in Massachusetts, how it could potentially benefit health and health equity, and discuss how it's cost saving? So over to you, Steve.
Sure, thanks, Molly. I'll do all that in under 10 minutes, no problem. And next slide. Of course, we're supported by NIH, the JPB Foundation, and the CDC. Next slide. Sugary drinks are the #1 source of added sugars that Americans consume, and therefore they're a really important ultra-processed food. But the beverage industry spends about $1 billion a year just advertising sugary drinks in a variety of media, with a frequent focus on advertising towards youth, especially Black and Hispanic and Latinx youth. There's just so much research that documents how increased consumption of sugary drinks increases risk of excess weight gain and obesity, type 2 diabetes, and cardiovascular heart disease and certain cancers. Of course, a lot of kids, youth, drink sugary beverages. We have lots of data on this across many states, including Massachusetts and the city of Boston. You can go to the next slide. The sugary drink excise tax is a tax on sugary drinks that's applied to beverage distributors, and they then pass this cost on directly to consumers. Sugary drinks include all beverages with added caloric sweeteners, so like sodas and fruit drinks. It does not include 100% juice, milk products, or artificially sweetened beverages. They would be exempt from this tax, but the one that we talked about in Massachusetts. There are a couple of different types of taxes. We've looked at both of these in Massachusetts and projected their impact. One is the type of volume tax that's been applied all over the United States, and it's just a tax that depends on the volume of sugary beverages. And in this case, it'd be 2 cents per ounce. That would be the tax. A tiered tax is one that's varies depending on the amount of sugar. So if there's less than 7.5 grams of sugar, there's no tax. If there's 30 grams of sugar or more, then it's 2 cents per ounce. And if it's in between, it's 1 cent an ounce. And we've studied both of these, and I'm going to talk about the tiered tax today because that's very similar to a tax that's been proposed in Massachusetts a number of different times. But as we do the analysis, it turns out that the results are pretty similar, whether it's a volume tax or a tiered tax. And the reason being that most sugary beverages just have a lot of sugar. And so they all most of them tend to fall into this upper category. The next slide. Perhaps most important, there's just really strong evidence that sugar-sweetened beverage excise taxes reduce consumption and impact weight gain. There's just been lots of evaluations of taxes implemented in multiple countries throughout the world. It's not surprising if you raise the price of a good like sugary beverages, people will purchase less of it because it's more expensive. And in the United States, you have very well done evaluations of taxes in multiple cities, including Berkeley, Oakland, San Francisco, California, Philadelphia, Pennsylvania, and Seattle, Washington. And all these indicate really strong effectiveness in reducing sugary beverage sales and consumptions. And studies in multiple other countries have validated these results. I know we've done some work in Mexico. More recent studies are now showing the impact of these excise taxes on actually reducing weight gain, excess weight gain in children and adolescents. And I think that's what's really kind of important here. These kind of taxes can slow the rise in excess weight gain in the population. As we've talked about before in our coffee chats, rates of obesity and excess weight gain just keep on going up in the United States. And we need to find ways to slow that rise or even flatten it out or reverse it. So if we go to the next slide, we've used the choices microsimulation model to project the impact of a sugary beverage tax in Massachusetts, putting in all this information from prior studies about the effectiveness and the likely impact. We project the future course of the obesity epidemic in Massachusetts by evaluating how an identified strategy will impact obesity, excess weight gain, healthcare cost, quality adjusted life year outcomes over a 10-year period. And we use a wide variety of both local and national data sets to really populate this model. For Massachusetts, that includes census data and then sugary beverage data. Next slide. This slide is kind of busy, but it kind of summarizes the main findings from our report. And I think Stephanie has put in the chat the report for Massachusetts. A sugary beverage excise tax in Massachusetts, we project to be a cost-saving tax, meaning that it would save more in future healthcare costs than it would cost to implement. And I think it's important to note that that projection and that statement does not take into account the revenue from the tax. It's just the impact of the tax on consumption of sugary beverages, which frankly slowly harm your health, and then the impact on future healthcare costs. So we project that there will be many fewer sugary drinks consumed by people in Massachusetts after this tax. 120,000 fewer decayed, missing, or filled teeth just among Medicaid participants. It would prevent 2,450 cases of diabetes, prevent 62,500 cases of obesity in 2030. We just use 1 year as an illustration of the impact. And for a really important outcome, we project that there'll be greater change in obesity rates, more prevention among Black and Hispanic and Latinx residents, leading to improved health equity. The cost impact of this tax, we calculate that it would save $246 in healthcare costs for every dollar spent on implementing this tax. And at the individual household level, we projected household would just spend less on sugary beverages, $165 less per year, because everybody will just be consuming less of a beverage, frankly, that's slowly harming their health. The legislature measures for a tiered sugary beverage tax have been proposed in Massachusetts, and we kind of based our tiered tax upon what has been proposed. It paid by the sugary drink distributors. And the tiered tax and the volume tax would raise pretty much similar amounts of annual revenue between 226 and 322 million a year, which is a lot of money. And this could be used for a lot of other potentially really useful things. And Sara now is going to talk about her experience. She spent a good deal of time working with the evaluating the sugary beverage tax in Philadelphia. Go ahead.
Thank you, Steve. Good afternoon, everyone. It's really nice to be with you all. And just to pick up on that last point, so in Philadelphia, the beverage tax is raising about $77 million in revenue annually, whereas what you just heard from Steve is that here in Massachusetts, it would be much, much higher, orders of magnitude higher, so potentially up to 322 million. So the revenue generated from these taxes can be very significant for cities and for states. So what I wanted to say just before jumping into thinking about how revenue is being used is just to underscore the importance of the work that Steve just presented. So for a very long time, there has been evidence which says sugary beverages are bad for your health. As you heard from Steve, they are one of the largest sources of added sugar in the diet, and they contribute to all sorts of adverse health conditions. So obesity, diabetes, heart disease, cavities. There was just a study that came out this month, and it really underscores the danger of sugary beverages. So the study looked at ultra-processed foods, and that's a broad category, which makes up about 73% of the US food supply. And it focused on which ultra-processed foods are the worst of the worst. And of course, sugary beverages are a type of ultra-processed food. And what the study found, which was in Lancet, is that there are two categories which are the worst of the worst. And I'm very pleased to report that I pick up 5 kids from soccer every Tuesday and Thursday, including my own. And when the study came out, I asked all 5 kids, I said, what is the worst of the worst when it comes to ultra-processed food? And they all got one of the answers right, which is sugar sweetened beverages is one of the worst of the worst. And then the second, in case you're curious, is processed meat. So bottom line, as we think about sugary beverage taxes and tools to reduce sugar beverage consumption, it is hard to overemphasize just how bad sugary beverages are for health. And then if we just take a step back, because we're focusing on taxes, but if we take a step back and say, what are the main policy options which can be used to reduce beverage consumption, or sugary beverage consumption, I should say, there really are 4 of them. One is financial, which is taxes, and that's what we're talking about today. Another is advertising, so think warning labels. A third is default, so that could be like a healthy kids beverage when you go to a restaurant. And then the last one is availability, so it could be healthy retail policies. When you put all that evidence together, we have the strongest knowledge base for beverage taxes. And the work that Steve just presented builds on similar analyses in other geographic areas conducted by the Choices team over the past several years, which provides really important evidence for how sugary beverage taxes can positively impact health and health equity. Now, I come at this work as a researcher, but I had the opportunity to spend some time in government. And one of the things that was really striking to me is that as policies were being considered, there are really two main questions that get asked. How much does it cost? And what's the impact? And that's exactly the information the Choices team is providing, in this case, around a sugary beverage tax in Massachusetts. And I just want to underscore one other point that Steve made, which is about the type of tax. So we have 7 localities in the US that have beverage taxes, and they are all excise taxes. And so we just talked about this, but just a foot stomp on what that means. It's a type of tax that is applied to the distributor, and then the distributor makes the choice to pass it along to the consumer. And so there's been a lot of studies which have looked at this concept of pass-through. To what extent is the tax being passed through to the customer? But the important takeaway is that the excise tax is not being levied on the customer. It is being levied on the distributor. So if we can go to the next slide, my task for today was to talk to you all about, well, how is all this revenue used from beverage taxes? Because it does raise tens of millions of dollars. So this slide is from a paper by Jim Krieger and colleagues that came out in 2021. And the purpose of the paper was to look at how revenue from sugary beverage taxes in the 7 cities that have them, how the revenue is being allocated. So the overarching message from this slide is that sugary beverage taxes are raising a whole lot of money, which is being invested in communities to address important needs. So areas like early childhood development, improvements to community infrastructure, and increased access to healthy food. So if you hone in on this slide, take home point number 1. Across the 7 cities, they raised $134 million in revenue. Take home point number 2, most of the allocations, so about 97 million of that 134 million, was administered through city departments, through Parks and Recreation, Health and Human Services, and then a smaller amount is going directly to community organizations, schools, or clinics. The third take-home point is that in most cities, the majority of the revenue allocations are supporting health-related goals. So in Albany, it's 100% of the allocation. In Berkeley, it's 87% of the allocation. And in Boulder and San Francisco, it's 79% of the allocation. And the final point that this graph is showing you is that across all cities, investments in human and community capital account for about 2/3 of the total allocations, with a bunch going towards child development. So you can think about pre-K subsidies, support for children ages 0 to 3, expansion of health education, physical activity and healthy meal provisions at childcare sites, and other things to promote early child development. And then the second largest share is going to community infrastructure, parks, recreation centers, libraries, and senior centers. And so these are really large community commitments that are making a difference in people's lives. So if we go to the next slide, I just want to take a deeper dive into first Philadelphia, which is this slide, and then Seattle. So what the prior slide taught us is that most cities with beverage taxes allocate the majority of the revenue to support health-related goals. But I wanted to spotlight Philadelphia because it's a little bit different. So as I mentioned, they raise about 77 million annually in beverage taxes, in revenue from beverage taxes. And where they dedicate most of their money is to human and community capital in 3 main categories. So the biggest is pre-kindergarten slots. The second biggest is rebuilding community infrastructure, so renovating parks, rec centers, and libraries. And the third area is funding for community schools, which supports a broad range of areas like job opportunities, ways to make it safer for students to get to and from school, healthier food to help families that are facing hunger, parenting classes for teens that are raising children, library renovations, and the list goes on and on. If we go to the next slide, this is now Seattle, and they raise about $23 million a year in revenue. So if you just think about this, Philly's around 77 million, Seattle's around 23 million. So big differences in the amount of revenue based on the size and makeup of the city. And so what Seattle has done is they've divided their allocations between healthy food access and early learning programs. And so what you can see from this slide is that their healthy food access has focused on 2 main areas: increasing equitable access to nutritious food and beverages at places like food banks and food delivery services for families and elders. And they're also promoting health through community-led projects such as the Food Equity Fund, which is a community grant program that invests in efforts to create an equitable and sustainable local food system. And then the second area is child health and early learning. And that has focused on increasing equitable access to higher quality childcare through actions such as expanding childcare subsidies for working families. And then within that bucket of child health and early learning, there's also been an investment in child health and development through programs such as the Prenatal to 3 community health grants. And the purpose of those grants is basically to improve kindergarten readiness. So the last thing I just want to say before we open it up to all of you or take questions from Molly is, what this leads us to think about is, well, let's say that Massachusetts was able to pass a sugary beverage tax. Where would it potentially use those dollars? Again, as Steve said, it could be up to about $332 million in revenue. And so there are many, many ways that Massachusetts could think about using the money. It could go into public health, it could go into nutrition programs, it could go into clean drinking water, and would actually just love to hear from all of you, if you're in Massachusetts, where you think revenue should go if the state were able to pass a beverage tax. So I'll stop there and turn things over to Molly.
Fantastic. Thank you so much, Sarah. And thank you, Steve, as well, for, orienting us on the topic and overviewing the great modeling results that we have from Massachusetts, and Sarah, especially for sharing your expertise on where, we currently have taxes and how the revenue is being used. And I think that's a great question that you've asked as sort of some food for thought for folks to kind of get thinking a little bit here. We have another question as well that we kind of want to pose to the group. So I'm gonna put it in the chat, and I want to invite folks to respond via the chat as well. And we're just curious if folks have any experience or any thoughts on any arguments around supporting sugary drink excise taxes that would resonate the most with your key partners. So from your perspective, what might you use towards that? So please share in the chat. We would really love to kind of see your responses to that. So please do share. But I think we also have several questions for our speakers here. So I would really like to turn to those as well. And please keep your questions for the speakers coming as well. So just to sort of start things off, I want to ask, I think both of you, and maybe Sarah can start, why are sugary drink taxes such an important policy lever when it comes to improving health and health equity?
Yeah, it's a great question. So one reason why beverage taxes are important is because they're easy to understand. So, when you start talking about junk food taxes, that's sort of an amorphous category that means different things to different people. But if you polled everyone and you said, do you know what a soda is? Do you know what a sugary beverage is? The vast majority of people understand what it is conceptually. And there's broad understanding about the negative impact of sugar on health, particularly sugary beverages on health. So from that perspective, there's broad public support. The other thing about why these beverage taxes are so important is that they can simultaneously, as we saw from the research that Steve presented, simultaneously have a tremendous impact on public health and health equity and raise enormous amounts of revenue, which can be used to further promote health and health equity or be channeled into other key services in cities like parks and recreation or schools or other things where revenue is needed. And it is the revenue generation that has, for some policymakers, made these taxes very, very attractive and what has allowed the taxes to get over the finish line and become passed.
Yeah, that's a great point, Sarah. And I think I'd just add that as we've worked with a lot of states and cities around the country, both blue states, red states, and cities, one thing that struck me is that they're really, I think I hear some conversation in the background. I don't know where that's coming from, but one thing that's really struck me is people are really interested in the cost-effective character of this, the fact that these are cost-saving strategies. There are very few intervention strategies or policy changes that actually are cost savings. That's true in healthcare, and that's certainly true in the preventive world. And so it's kind of an extraordinary intervention in that way, and one that I think people find really compelling. And then, as Sarah has pointed out, there's this additional revenue generation. But it's really a win-win-win-win, improving population health, being cost savings, bringing in revenue, improving health equity, doing all these things, and at the same time, really reducing the impact of this ultra-processed food that is so heavily marketed in our society. And I keep thinking back to the early days or the early decades of the tobacco wars, where it took literally decades to really limit the sales of tobacco. And I will also remind people that until about 2001, there was really no clear evidence on the health impacts of sugary beverages. So it's very recent evidence, but it's grown rapidly. There's now just tons of evidence. So it's an important area of intervention, and it's quite an effective intervention and cost saving and equity enhancing.
If I could add one more thing. So when the beverage taxes were originally starting, there continues to be an enormous amount of industry resistance. And one of the things that's been helpful from the public health side is a lot of the key arguments that industry has lobbed towards beverage taxes as reasons why they won't work or will be big barriers for consumers. There's been empirical research to discredit them. So for example, in Philadelphia, there was a feeling that, well, if you put beverage taxes in place, you're going to cause people to lose jobs because they won't be able to then work in the stores that sell the beverages because they're losing so much revenue. And so as part of the team that did the Philadelphia beverage tax, I was part of a study that asked that question: do beverage taxes have an impact on unemployment? And the answer was no. So I think in addition to sort of understanding what impact do beverage taxes have on prices, volume sales and consumption, and then down the line, obesity, it's also been important to do empirical analyses to ask the question, is this argument that's being put forward by industry, is it accurate? And to the extent to which it's not, then using that as additional reasons to say, here's why beverage taxes actually are not as problematic as you might think they are.
That's such a great point, Sarah. Thank you. And thank you both for the great response to that first question there. I think you really underscored again just how valuable this can be, both with all the different investments that can be made with the revenue, and Steve, to your point about the cost savings that we could see, and then just the really positive impacts on population health. And appreciate you mentioning there as well about those industry arguments, Sarah. So I think this is a great opportunity to highlight what someone has shared in the chat. Leslie shared an example of an argument that could resonate the most with key partners. Funders are moving away from food access and food security, so it is putting our emergency food providers in a hard place to be able to serve their community needs. They need a sustainable funding source. So I think that's a great example of just, again, how useful this policy could be as a source of funding, and sort of allocating funds to something that really needs it. So thank you for sharing that, Leslie. And again, others, please do share findings or arguments that you can think of that would resonate with your partners. And certainly folks in Massachusetts in particular, to Sarah's question that she posed earlier, any thoughts on uses for revenue in Massachusetts? We'd really love to hear your thoughts on that. So keep that coming in the chat. And in the meantime, another question for
I have some thoughts on how to use the revenue. I mean,
go right ahead, Steve.
I find it embarrassing in Massachusetts that we support early care and education so little. It's just, I find it embarrassing for a state as wealthy as we are. And one way to come up with additional revenue and spend that revenue is to spend that on subsidies for early care and education, particularly for low-income families. And I think you can do that for just about all low-income families in Massachusetts with this amount of money, just like they did in Philadelphia. But there'll be one way to spend the dollars. I don't know if it's possible to do that, but that's something I'd like to see because it'd be so important for our future.
And Molly, if I could respond to Leslie Levine's comment. So it's such a great point. And I had the opportunity of working in the first years of the Biden administration, and in that time did work around nutrition security. And one of the really interesting things that I sort of understood but didn't fully appreciate is the exact point you're raising, which is the enormous strain that's been placed on the emergency food sector. But the other thing that I didn't appreciate was how many of the permanent federal nutrition assistance programs are underutilized. And so WIC, for example, only about half of those eligible participate in SNAP. It's about 90% of those eligible participate. Mostly it's elderly, they get smaller benefit amounts, they're not utilizing them. In school meals, it's similar, it's not fully utilized. So I think that you're exactly right that more support is needed in the emergency food sector. And there need to be more efforts to encourage eligible families to take advantage of existing resources that are permanent and ongoing, that are going to allow them to have a more steady stream of resources to access food.
Great points. Thank you both so much. So another question I have here, and I mean, I think we've touched on it a little bit, but how could we maintain momentum in support of these taxes when there is a lack of political support? Maybe Sara, you could start.
Yeah, that's a great question. So, and it's a very appropriate question because there's been a lull since we've had our last beverage tax. There were a bunch that were clustered together, and now it's been a while. So how do you maintain momentum? One thing that's been really important is that the science that Steve and the Choices team are doing is sort of building up this arsenal so that when the moment becomes right, you can sort of push through the evidence that's going to help convince policymakers about why this cost-saving intervention makes a lot of sense. So one way to maintain the momentum is to keep the science going. Another thing that's really important is science-based advocacy. So it's important to, create the evidence, but then you have to get it in front of the people who are in positions to make decisions. And so there are a number of people in the public health space that are doing exactly that, like trying to be bridges and take the evidence and translate it. And the third thing is when talking to folks who are in a position to be making these decisions, to frame it in a way that actually matters. So for example, if you're trying to convince someone about the importance of beverage taxes and one of their key policy positions is the health and well-being of school children, then focus on why it's going to matter for school children, and focus on why sugar is going to really make it hard for them to concentrate, et cetera, et cetera, et cetera. But it's really important to know your audience and to meet them where they are and to give them evidence that is consistent with where they are trying to go.
I think I just add that there's also a very profitable and well-funded industry that does not really want to see these taxes take place. And they make a lot of money selling sugary beverages in the United States and throughout the world. So if you have a well-funded industry like that does not want a tax like this, it's hard to maintain momentum. Particularly when you have not that amount of money on the side of trying to create change. It does remind me of the tobacco industry and how long it took, decades and decades. And I think it'll still take quite a while to make changes in sugary beverages. But changes are already happening. I mean, we've pretty much gotten a lot of sugary beverages out of schools. I remember in the city of Boston, the late Mayor Menino used to say it was the hardest thing he ever did was to get the sugary beverages and the vending machines out of the schools. Well, there have been changes, positive changes, but it takes quite a while.
Great responses. Thank you. I do see in the chat that Leslie, who shared such a great argument before, noted that they need a lot more navigators to get people signed up for government programs. In Colorado, they have a Healthy School Meals for All program, which is amazing, but has resulted in families not completing paperwork, and a fund created through a tax like this would help school meal programs and double the impact in communities. I think that's a wonderful example. And a great point, and I think a really nice segue into another question I have. What arguments in favor of sugary drink taxes seem to resonate the most with policymakers and practitioners? So I think Sara and Steve, if you have a comment for Leslie or a comment more broadly on that question that we're really wanting to hear about, feel free to jump in.
You want to go first, Steve?
Well, I want to hear from our audience. I want to hear an argument that they think really resonates. They were having a coffee chat. This is not a just sit and watch. But Sarah, you have something you could.
Well, I think what's going to resonate most is going to depend on what an individual's goals are. So, and going back to the point about just this accumulation of evidence, there's so many different pathways that you can point to for effectiveness. So let's say that someone really cares about equity, then you can point to the fact that sugary beverage taxes are improving health equity. Let's say that someone really cares about creating resource for another thing that they really want to make happen in a city. You can say, look, you can raise tens of millions of dollars in revenue that you can then use for park improvement and other things. And so I think it really depends on what is the thing that matters to the city, that is going to help drive the policy positions that they believe in. But honestly, at the end of the day, the thing that probably is going to make the biggest difference is the point that Steve made earlier, which is it's actually cost savings. So you have all these positive impacts you can point to, and it is cost savings. And at the end of the day, it is money, which is often driving decisions.
And I think the history of the tobacco taxes across states is illustrative, and it did take substantial, essentially social movements to create those kind of changes. And it's hard to create social movements that are sustainable. I think one thing I've seen, I guess I first saw social movements happening a long time ago, and they tended to be a lot more sustainable than some of the social movements today, which can almost happen in a flash and be gone in a flash. Creating a sustainable movement in this arena is tricky. And I think we need probably new ideas about how to do that. So I think we have a comment from Claire.
Yeah, thank you. Claire, I see your raised hand. Please feel free to go ahead.
Thanks. Good afternoon, everybody. I was hesitant to share, Steve, with your call to action because I don't think I have quite as eloquent words as Sarah did, but one of the things, from the Massachusetts Department of Public Health, for folks who missed my chat earlier, and I've been fortunate to partner with the Choices team the last handful of years, looking at cost effectiveness of various interventions for preventing childhood obesity. And I think one of the key things that I've learned in this time is the importance of the right message for the right audience. And so certainly you'll be talking to partners who are really concerned about the regressive nature of an excise tax and how that will be passed on to the customers. And so addressing the injustice of predatory marketing practices of the sugary drink manufacturers, making sure that I have talking points ready around that, and then also looking at the equity impacts, the advancing health equity of this kind of an intervention, I think can be powerful for those audiences. And then we're in a we are a wealthy state, and we're in a really tight fiscal situation this current year. So thinking about opportunities for the appropriate investment that is could potentially come from the revenue of a sugary drink excise tax, I think is really important to consider, both in this is how we could generate some more revenue for communities, but I think it would really be important to make sure that it's going into the right thing. And so I love the idea of parks and green space. I love the idea of early childhood investments. We are looking at a community initiative called the Root Cause Solutions Exchange here, which really supports communities in community to community sharing around capacity building for addressing root causes of obesity, heart disease, violence, poor maternal outcomes, right? So when we're thinking about root cause work, that really is going to support communities in any number of downstream health inequities that we're super concerned with. So looking for, I would say in Massachusetts, it'd be really interesting to see what it would look like if it was a steady investment in that solutions exchange hub.
Thanks so much for sharing your perspective, Claire, particularly from the Massachusetts point of view. Wonderful to hear. So really appreciate that. I think another question that we have here. So Sarah, I know you mentioned before about the impact on employment, which is great. And I wondered if you could speak a little more specifically about impacts on sort of small businesses, and then sort of in a related sense, ways of sort of gaining support from small businesses with this type of policy.
Mm-hmm. So the small business question matters a lot in the context of beverage taxes, particularly when they're in urban cities, because like if you take Philly, which has a beverage tax, there are thousands of these little tiny mom and pop corner stores, or they're bodegas, but they sell a lot of sugary beverages, a lot of ultra processed food. And for a lot of them, sugary beverages are a core part of revenue. And so as questions are raised about beverage taxes, small businesses tend to get nervous. You're going to increase prices. Customers are not going to come in. It's going to hurt our bottom line. So going back to the point around, as concerns have been voiced, what has the evidence shown us? So if you look, there's a study done in California, which looked at this question of how do small businesses feel about beverage taxes, and looked at small ones and looked at big ones. And what they found is that 70% of retailers, big or small, said that the beverage taxes had no impact on their bottom line. So that's point number one. Point number two is that there was a strong interest. Again, the study was done in California. There was actually a strong support from small businesses that the tax go beyond the city they were in, because their concern was, well, if you tax my city, then people can drive to another city and buy beverages there, and then I'm going to be losing revenue. And one thing that we did see in Philadelphia is that this concept of cross-border shopping, so you leave the tax jurisdiction to go to a non-tax jurisdiction to buy beverages that have added sugar, that's a real phenomenon. And so small businesses, at least in the case of this study, they sort of want to just be treated fairly. Like if you're going to raise the taxes, fine. We don't see it having an impact on our bottom line, but we want to be treated like other retailers that are surrounding us so that we don't lose out in the process.
Yeah, thanks, Sarah. That's a great point. And that's just another one of those reasons for a statewide tax. Yeah.
Exactly.
Yeah, thank you, Sarah. Thanks for really highlighting the evidence there. And I think that segues into another question that you have already addressed a little bit too, but I'd love to hear more from you and from Steve as well. Some of the key arguments against these taxes, and if those arguments are supported by evidence.
So this was raised by Claire, this issue of regressivity. So I think this is the one you hear the most. Taxes are going to, people that have less money are going to pay more in taxes. Now, the regressivity argument, from my perspective, completely dismisses the fact that it has a progressive impact on health. So what that means is you are lower income, you are more likely to consume sugary beverages. You are a racial ethnic minority, you are more likely to consume sugary beverages. A tax goes into place, and what the evidence suggests is that consumption is falling faster among higher consumers. Those higher consumers tend to be lower income households and people that are from racial ethnic minorities, which translates into greater health benefits amongst that group, which is why Steve's research is seeing this impact on health equity. And so you can say, if you take a surface perspective, yes, you can say if two people are buying a beverage and one has more money, then it is a regressive tax against the person with less. But that is a very short-sighted view and does not take into account all the empirical evidence which suggests that beverage taxes are benefiting health, particularly for people that are at higher health risk and also tend to be lower income and historically underserved.
Yeah, thanks. Thanks, Sarah. That's very clear. And I think I'd also add that on average, everybody will be spending less on these sugary beverages. So in that sense, saving more money that they could spend on other things. And for those consumers that do keep on purchasing the beverages, the amount of tax averages out to about $1 a week. And so for a higher income person, it's true that'll be a little smaller part of their income. But as Sarah points out, this ignores all the health benefits, the progressive health benefits, and it's still $1 a week. Yeah.
Wonderful. Thank you both for highlighting. I think that is one of the most important arguments that we've heard, and I think was the goal of our real framing today, was highlighting just how progressive this strategy can be from a population health, health equity, and cost and revenue point of view. There's so much great that can be done with it. So thank you for addressing those points. So we are wrapping up here. So folks, hang around for just a moment here for a couple of closing notes. So we always like to invite folks to share anything that you've learned today, something that was surprising to you, something you're going to take away. If you'd like to take a moment and share that in the chat, we would really love to see that. I also want to remind folks we have many more resources, past coffee chats, including another recent one with Sara from earlier this year that you can view at your leisure on our Choices website and our Community of Practice portal and our resource library. So we'll be putting a link in the chat to that, and folks can you can sign up for free and access those resources. So please do go check those out. There will be a little survey that will pop up when you exit the meeting today. We really appreciate folks' feedback, so please take a moment to do that. It should only take a minute or so. And as a reminder, we will be sharing the recording from today, the slides, and a resource roundup document. So it'll include links to the different peer-reviewed papers, and certainly the link for the Massachusetts report that we were talking about will be included in that document. So please be on the lookout for that. So again, I really want to thank our speakers, Sara and Steve. Really appreciated having you come on today and share so much about sugary drink excise taxes, the work we have done in Massachusetts, and the many progressive impacts that could result from this. So thank you so much. And thanks to all of you for joining us.
Thank you all.
Thank you.
Thanks, everyone.
Have a good day.